First thing that at the end of the day, people always ask, how big is my incision going to be? And, I tell them, well, we just make it big enough to do what we need to do safely. And sometimes that means it can be, a couple of inches. Sometimes it means it's 6 or 7 inches long, depending on how difficult and complicated the situation is. But I remind them at the end of the day, the incisions heal. We're very careful with tissue protection and not as destructive as we were before when we didn't have the technologies, but you ultimately have to get the bones fixed. You have to get the underlying problem healed. And that used to be the Achilles heel of spine surgery. We could get in, we could put things in, and then they wouldn't heal and they would kind of fall apart and the patients felt worse than they did to begin with. So the fact that we've been able to drive clinical outcomes in cervical and lumbar fusions and disc replacements, et cetera, well into the 90s. Most patients are getting good results. Doesn't mean 90% pain relief, but 9 out of 10 people are getting what they consider 50 to 80% improvement, which is very, very beneficial to them. Now the era is swinging towards shrinking the incisions. So the technologies that are really, really evolving are the robotic-based, the what we call stealth navigation, being able to make a small incision on the skin, hold something on the skin and look at a screen and have an understanding what's going on 6 or 8 inches deeper, where the bones are, where the organs are, et cetera. So the next group of surgeons, the younger surgeons than me and Dr. Schuler, et cetera, are really moving the needle in that direction. So these are literally the docs that grew up on video games. These are the guys who are very comfortable with that platform. And I think as long as we don't sacrifice the good results we get deep down inside the spine where it needs to heal, some of these procedures are just too minimally invasive and they can't really get the orthopedic part done. As long as we keep that in mind and balance those, I think the technology is moving us more and more toward, shorter lengths of stay, outpatient surgeries. But at the end of the day, we got to remember, at the end of the day, we have to fix the spine.